Welcome back to another insightful episode of Med Talks by Dr. Anita. Our host is very special for today. Well, let me tell you, I have a reason to it. I mentioned already in my previous podcast, I will be inviting this persona again on my show since one show will not justify his expertise. So I have here Dr. Mohan Rangaswamy back to my show. With more than 3 decades of experience, Dr. Mohan Rangaswamy is a plastic surgeon whose skills and precision are truly unmatched. His expertise in both aesthetic and reconstructive surgery is not just about transforming appearances, but restoring confidence and quality of life for his patients. It's this depth of knowledge and hands on experience that I want to bring to you, our listeners, once again. Dr. Rangaswamy's patient centered approach and his mastery over intricate procedures make him a treasure trove of insights. From pioneering advanced techniques in reconstructive surgery to contributing to the emerging field of regenerative medicine, his contributions to the field are vast and invaluable. My aim today is to delve into every detail of common procedures in plastic surgery, especially those shaping the field in Dubai, so that more people can understand the life-changing potential of this specialty. It's a conversation you won't want to miss as we explore the finer points of his practice. Welcome to Med Talks by
Thank
Dr.
you.
Anita once again,
Thank
Dr.
you
Mohan.
once again. Thank you for inviting me again.
Yeah, it's a pleasure. And
I-
it
I
will go
hope to-
on more.
I hope to share my experiences and what insights I have into the practice of plastic surgery in this beautiful city of Dubai.
Absolutely. Dubai is beautiful, full
Yes.
of wonders,
Yes.
full of beauty.
Absolutely.
And then there are people like you to enhance it. So yes, yeah, we are in right place. Yes. So Dr. Mohan, I want to understand what are the common procedures you usually come across in Dubai? I'm sure you travel as well, but I would like to know in Dubai, what are the common procedures you come across?
Okay. In common with the rest of the world, liposuction is one of the commonest. So liposuction of different parts of the body for different purposes is the commonest. Combined with that, increasingly now fat grafting is also coming in, because when we do
Okay.
liposuction, we get the fat. And I always inquire with the patient if she would like to use this fat in some part of the body, which can be enhanced at the same time. So it's a bonus.
Wow. So it
Yes.
gets on the same time it's done.
At the same time it is done,
Oh,
because
wow.
fat is a living tissue and it can be put to good use. And increasingly now we know the power of fat grafting in cosmetic field, in reconstructive field, and in the new regenerative field. So fat, I say, is gold. It looks yellow,
Wow.
and therefore fat is
Oh,
gold.
yes.
And I try to convey this concept to my patients that fat is gold, fat is your resource, especially if the person that is coming in for a liposuction is looking for shape correction, which is of course the correct indication for liposuction. But if she is not very rich in fat, let's put it that way, then I do look at her body and see, it's not my policy to sell procedures, but however, in this one, I make an exception. If I see that this person can benefit, let's say in the breast region or the buttocks region, or I see that the skin on the hands is looking more aged than the person, then I do propose to them the possibility that, look, I can use this fat to good use and you can have these improvements. Would you be interested? That's all. We leave it at that and let the idea,
Thrive in the
thrive in
patient's
their
mind. Right.
And they can come back, and sometimes they come back and say, yes, doctor. And there are patients
I'm
who
sure most of the
absolutely
times.
say, no, I don't want. And post-operatively I said, I wish I had listened to you.
Oh,
I say, so too late. The resource is
Yeah.
gone.
true.
Yeah.
So that it's a
So
golden.
liposuction is the commonest. And the other common procedures sharing the same slot, I suppose, is breast correction surgeries, which can be augmentation or reduction. Increasingly, reduction is popular now. The craze for big breasts is kind of over. But still, there are some people who come to my practice and they say, I want a 500cc implant. We'll talk more about it when we talk about breast
With
augmentations.
specific measurements, basically.
So they come with some idea from the internet, from Instagram and whatever, but that's not the way it works. So getting back to your question, so liposuction, fat grafting, breast corrections, facelift is a little bit less common. So the third commonest would be tummy tuck, abdominoplasty in a slightly older age group where they have had a few children. And
Abdominoplasty.
tummy tuck.
Different than tummy tuck.
It's the same. It's a medical term for tummy tuck is abdominoplasty.
Okay.
And what I perform is actually lipo-abdominoplasty. So we combine
Together.
liposuction with abdominoplasty.
Because we use the golden fat.
We use the golden fat. No, not just that. Lipo-abdominoplasty is a very specialized form of tummy tuck, which is now becoming more popular in the world. But I started with this in 1995. So here we do
95.
liposuction. Yeah, we do liposuction first,
Oh my goodness, I'm thinking my age at that time.
So we
No wonder,
start
years of experience.
with
Yes.
liposuction first before actually making the cut for the tummy tuck.
Uh-huh.
And we complete the liposuction of the abdomen so that the whole abdominal skin is now very mobile.
Right.
It's like a honeycomb has been made under the skin. So when I cut the skin, elevating the skin, doing the dissections is very easy, and I don't have to lift the skin all the way to the chest, which is what was done in the traditional tummy tuck and
Previous
which is
times.
still done by many people for the traditional tummy tuck. But I do lipoabdominoplasty, so then I just have to do a minimal amount of dissection to repair the muscles which are usually separated after
Dissection
the
as in cut.
yeah, to elevate the
Minimal
skin,
amount of
mainly in the middle, to expose the muscles, and we repair the muscle gap to tighten up the musculature, and then we pull down the skin, take away the excess. So what happens in lipoabdominoplasty? The amount of dissection is less, and the nerves and blood supply is preserved. So my patients do not experience numbness of the abdomen after the tummy tuck.
Wow.
Usually
That's very
after tummy
common.
tuck, the lower abdomen goes numb because all the nerves have been cut, but not so in this technique of lipoabdominoplasty. So this is also common.
I'm sorry, I want to mention, as we mentioned in our previous podcast, tissue respect.
Yes, of course.
Yes, so that's
Yes, of course.
what you have.
This is
I
the-
mean,
this
of
is the
course,
concept,
Of
yeah.
course.
So combined with this nowadays, it's very popular to have 360-degree liposuction. So we do liposuction of the back, and then the fat from the tummy and the back can be added to the buttocks to enhance the profile. So what you get is a drastic change in the figure.
Oh, so it's done from the back as well, huh?
Yes,
I thought it was only the front.
liposuction of the entire back and liposuction of the front for the tummy. Simultaneous fat grafting to the buttocks. So you get that S curve
curve.
on the profile view, and on the front view, because we do the liposuction of the back, the waist gets narrowed and we can flare the hips. So we can get the kind of figure, the wow figure that many women are desiring.
Wow.
And sometimes it ends up that the woman now has a better shape than what she had even before her pregnancies. So it is possible.
I wish I would have had some fat left for this before meeting you.
Now,
I literally removed everything.
to answer that question, in women, we can always find fat. Of course, there are some women who are like extra athletic
Lean.
and very, very thin.
Yeah.
But in a good number of women, when they think that they don't have much fat, the surgeon can still find fat. Of course, we have to
The
hunt.
experts can find that, yes.
We need to go to different areas and harvest the fat from different areas
Right.
if we want to give fat grafting to a specific area.
So we can expand this fat as well, or is the same specific fat you can, like how tissue
Well,
expander works?
usually the fat what we get is grafted.
The same you put.
Grafted.
Okay.
Now, currently we have, with the help of a laboratory that is there in Dubai, we can expand the stem cells. You see, fat contains fat cells and stem cells and a few other cells as well. But the stem cells can be extracted and the stem cells can be multiplied in culture. And then they can be infused back into the fat. For example, we take a 30 cc of fat, we send it to the laboratory, they take 3 weeks to make these stem cells. Now, next time I'm going to do the fat grafting for this person, I can take the stem cells from the lab, I can mix it with the fat, and then now we have supercharged fat or cell enhanced or cell enriched fat. Now, this fat has a higher percentage of take. Now, what do you mean by take? When we put fat in an area, let's say in the buttock area, which is the most popular one, let's say I put 500 cc on either side. We get a survival of about 50 to 60%. So let's say 250 to 300 only survives. So around 200 is lost. Why is it lost? Because those cells do not get their blood supply on the correct time and those cells die.
So it's not that the complete cells which is transferred will be alive.
Yeah, that is true. That is true. Of course, there are a lot of nuances in the fat grafting. So nowadays, we are able to get a better fat take by taking care of every step. I usually have a good experience with fat grafting. I've been doing it from 2002, and I follow all the guidelines that need to be followed. But here is the thing. If we mix it with stem cells, then cell-enhanced fat grafting, you can get up to 80 to 90% of survival. So the survival percentage increases because these stem cells are able to increase the local blood supply. They're also able to help those cells which are dying. See, for example, some of the cells will die straight away. Okay. Right. And there is no time to resuscitate them, so to speak.
Yeah.
Some of the fat cells survive for a few days and then, they are not able to survive any longer. But during this process of suffering, these cells release certain chemicals. These chemicals are identified by the stem cells. The stem cells get triggered and they multiply themselves, and some of the cells replace the fat cells.
Wow. So it's always better
It's
to
a,
get it,
it's
the
a, it's
stem
an
cells.
amazing process. It's an amazing
Wow.
process.
Really?
So in about 4 months' time, you reach the final situation. So
4
whether
months' time.
at 4 months, I say this is the final result. Now, after 4 months, if this person gains weight, these cells will accumulate fat. They will grow. If she loses weight, these cells will shrink. But the cells will be there. So they are living cells. They are living fat cells, just living in another area. Let's say they were living on the tummy and now they are living on
Living
the
in the buttocks.
buttock. So,
Wow.
so the fat cell is translocated to a different area. So this is how the fat grafting works. Because some people come to me and say, oh, but fat grafting is temporary and it doesn't stay. And my friend did it and it all disappeared.
Right. Oh, this is a common
Comments,
concern of people.
concerns that people. So the important thing here is that the fat grafting technique has to be very gentle. Again, we come back to the aspect of tissue respect, because if we have to do fat grafting and the graft has to survive, the fat cells have to be harvested. That means the liposuction has to be done in a gentle way with lower pressures. And then the fat has to be, baby handled so that it doesn't suffer damage. Generally, we try to use a closed system and we try to graft the fat back into the area without delaying it too much. It doesn't have to sit outside for 5 hours, 6 hours. Then, obviously the tissue, very well.
Yeah,
that
it will die, of course.
Tissue can die. So we take care of every aspect of the fat grafting. If you take care of it and also you do the fat grafting, making sure that it is surrounded by living tissues. Like if we say we fat graft in strings, let's call these strings as spaghettis. So in between the strings of spaghetti, there should be sauce.
Ah, okay.
So if two spaghetti strings are next to each other, they don't derive blood supply.
So you have to give enough gap so that they survive.
Few millimeters in between, so that the intervening host tissue. So this is the guest, and the host is the original tissue that is there. And the host has to give nutrition to the guest. Till the guest survives and can earn for itself. It's like that.
Wow. So it's
like
all
that.
about skills. It's all about skills.
Yeah,
to get good results.
Absolutely. Fat grafting has to be done in the proper way. And, there is intensive research going on. For example, now fat with stem cells is one thing. Fat with platelet-rich fibrin matrix, which I use rather routinely. Like I take patients' blood and I prepare PRP or PRP matrix.
So this can be used anywhere in the body, right?
Absolutely.
Wow.
For example, common areas are, of course, the face, the hands, breasts, buttocks, calf area, those who want to enhance their calf, let's say the ankle. Let's say there are areas where there is a depression due to some trauma, there is a scar.
I'm sorry, we'll come on this again. So I want to understand, PRP kind of a procedure is very common where they remove it from the blood.
So
but
that's right.
Same way, if you use the fat, you are actually removing it from the place where it's stubborn, and you can utilize it instead of PRP. I mean,
no, the two are not interchangeable. Okay. To understand this concept very well, let's say you go to the nursery and buy some plants and you want to plant them in your garden. Okay. And after that, you have to give it fertilizer and water.
Right.
Okay. So the PRP is the fertilizer. The fat is the plant.
Okay.
So if you just take soil and keep on putting fertilizer, what's going to happen? What's going to happen?
Right.
The existing grass will grow better. So if you do PRP to the face, for example, the existing cells over there, they get a little bit boost.
Nourishment.
They get some growth factors. The skin can thicken a little bit, improved vascularity and so on and so forth. It improves the quality. Certainly the PRP has a value.
Right.
But PRP, when it is added with the fat, and this has been my experience and also borne out in many studies, that it improves the survival of the fat and kind of acts to improve the blood supply in that area. And fat to survive has to have a good blood supply.
Right.
So fat survives better in a more vascularized area. Vascularized meaning the area which has a good blood supply.
So what are those
PRP helps in that way.
Okay. So what are the common areas you said
Once
we do
again,
this
fat
grafting?
grafting is to the face, the entire face.
But they will not look chubby?
Well, it depends on how much fat you graft.
Okay.
And it's not just a matter of pushing fat to make a moon face. It is strategic. Because, for example, I will address the hollows on the sides. I will address the under eye area. If we are putting it in the cheek, we put it in the high cheek and not in the mid cheek or low cheek, because we want that oval OG curve.
Right.
Okay. Oval is youthful. And as we age, the face becomes square or pentagonal. So if we want to take it back towards youth, then we like to see their photographs 15 years, 20 years before to see what their face looked like and try to go towards that. Now, there are a couple of concepts here. One is we are restoring the lost volume. And two, we are rejuvenating the tissues. Rejuvenation means that the skin starts looking younger because it is thicker. It contains more water after the fat grafting, because we are also grafting nanofat into the layer of the skin, which is called the dermis, right? So there is rejuvenation of the facial skin. There is volume correction, and there is prejuvenation. Now,
Pre-rejuvenation.
what is prejuvenation?
Rejuvenation.
Yes. For example, let's say we are doing a fat grafting in somebody who is, let's say, 35 to 40 years of age. Why? That person face hasn't started aging. But maybe a careful observer can observe minor early changes.
Right.
Now, if we do a fat grafting to this person, let's say she has an identical twin and this twin does not get fat grafting. 15 years forward, you will see that the one that got the fat grafting looks still younger compared to the identical twin who did not do fat grafting.
Whoa.
Because the fat grafting slows down the signs of aging on the face.
Right.
So we are rejuvenating before the need to rejuvenate.
Right.
Therefore, it is a prejuvenation.
Prevention is better than cure.
Prevention. So that is another area where fat grafting.
And body can take it more easily if you are you prepare it before itself.
So basically, there is another concept that I tell my patients. The fat in the face, let's say, has an expiry date of 45 to 50 years.
Sorry, please again. What is that?
Okay.
Very important.
So we have fat in different parts of the body.
Right.
The fat on the face, and let's say the fat on the tummy. If we compare them, the fat on the face kind of starts disappearing from certain areas or shrinking by the time a person is on the wrong side of 40. Certainly by 50. Okay, depends on the genetics, of course. Now, the body fat doesn't do that. In fact, it may increase with the middle age.
Right, exactly.
So, to understand this and to put it simply to patients, I say that the fat on the face has an expiry date written on it. 45 to 50 years.
When should I come to you?
And the fat on the body probably has an expiry date of 65 to 70 years. For example, a man goes bald because he's genetically destined to go bald. Why does he go bald at a particular age? Because the hairs in front, let's say, have an expiry date that you shall drop at the age of 45.
True.
It's just a concept.
Right.
It's just a concept. To put across scientific concepts in a simple way that easy to understand. So that I always try to do that, so that the person across the table understands in his or her own way. I often relate it to the profession of the person. So I ask, what's your profession? So if the profession is, let's say, an engineer, my talk will go more towards engineering language. I will talk structure, I'll talk support, I'll talk all that, materials, stuff like that.
Right. I'm a podster. I would need that. It's very important.
So this is one way to convey the messages. So these are some of the popular plastic surgery procedures now that are very popular in Dubai.
How many % of people you come across who understand this concept of how they can use the fat in unnecessary place along with tummy tuck? I mean, in liposuction.
That's right. See, it depends on if they already know about it. See, some patients, especially I have a lot of UAE nationals. For some reason, those women already know a lot. I tell you, they know more about cosmetic surgery than a general doctor.
Than we do.
Than a general doctor. Let's say a GP doctor may not know as much of the nuances of what is possible in today's cosmetic surgery. Maybe they talk among friends, or maybe read magazines. They are on the internet, maybe Instagram. All these put together, they already know. Many of them already know. But then sometimes their facts are not correct. Like, for example, they say fat is temporary, it disappears. So I have to correct their perception that fat is not temporary.
But more than perception, I think it's more the precision, basically, the skill, the way you remove it, the way you preserve it.
But even with the best of skills, you cannot get 100% survival.
Right.
So that's the concept that we need to
But there's
convey.
always a way to make it better with good hands, with good skills. Right?
Absolutely, up to a limit. The other thing is, when you get the procedure done, then in the first few weeks there is swelling. So you look at it and say, wow, fantastic. Then the swelling goes away. Then you think that it's going away.
Oh, right.
So objectivity, because a person who is seeing herself every day, may not be able to objectively compare and remember those appearances unless we document by photographs. Whereas I am seeing them, let's say, after 3 weeks, and after again another 1 month, 2 months, 3 months, I'm able to see. Now, sometimes when there is confusion or confrontation, say, okay, doctor, you are saying this, but I don't think my fat survived. So that's where the photographs help, because we try to keep photographic record monthly to show them that, look, this was it. Now this is it. Now you are in 4th months. Let's say this is the final. So if you take the final photograph and the pre-operative photograph, you can see the difference. Of course, if you want more, see, there are many places, especially the buttock area, where we need to do it twice.
Fat grafting.
Fat grafting twice. If they really want a phenomenal effect, it should be done twice. Why?
So is it possible the same fat? Because I'm not sure if there is enough fat.
No, same fat cannot be preserved.
No, but if you save it and you put stem cells in that and you preserve it, you cannot preserve that.
No. What you
Okay.
can do is small amount, again, the same specialized lab can preserve, let's say 100 cc of fat, but the preservation is expensive and it's specialized. I cannot take the the fat in a syringe and pop it into a freezer. No,
Right.
that is not allowed. That's not correct. Scientifically, that's not correct. So when we have to do a second fat grafting, we take fresh fat again by liposuction. Now, why do we need it twice? Because to enhance the volume, it also depends on how the skin will stretch. For example, those women who have, let's say, hip dips, the skin is dipping in,
Right.
but it's also tight.
It's tight.
It's
not
tight.
having enough space to.
What people don't realize is that the skin will not just balloon out. But you do a first fat grafting, in 6 months' time, the skin relaxes. All right. Then you have more room as well as more stretchability of the skin. So you have to build up slowly. All right. For example, and you will be amazed at this example. Let's say somebody, the breast was removed by mastectomy. Okay. Now she wants a reconstruction, but she doesn't want an implant. Okay. Without implant, it's possible to use flaps from the abdomen or from the back. There are techniques. But if somebody wants to keep it very simple, then we can do fat grafting. And if we can do fat grafting 4 times in about 2 years of time, we can actually build a breast just by injecting fat.
You can build anything, Dr. Mohan.
No, well, you're too kind. But returning back to the facts, this is breast reconstruction purely by fat grafting.
Wow. 2
And this
years,
is-
you said.
Yeah, because we have to do it 3 or 4 times. And this is possible in today's technology. It's possible. And if we use stem cells, it's even more possible. But of course, it is, if the opposite breast is of medium size, then we can match that only by fat grafting.
So instead of implant, we can use the fat grafting as well to enhance the breast.
That's right. But mostly now, if we are going with implant, of course, implant gives a definite volume immediately. We are also using fat graft. So it's a composite augmentation. If we talk of augmentation is when a woman has a normal breast, let's say it is a bit small and she wants it enhanced. That's augmentation. Breast reconstruction is she lost the breast for cancer treatment and now we are rebuilding the breast. Okay.
Okay, right.
In both situations, we use implants. In both situations, we use fat grafts.
Right.
And in a reconstruction situation, we need more fat graft for obvious reasons. So we must do the fat grafting 2 or 3 times. And every time there is an added benefit.
Okay.
Now, I'm going to come to a very important, very surprising fact about fat graft. It can reverse radiation damage. Now, what is radiation damage? Let's say part of breast cancer treatment, radiotherapy, is an integral part, especially if the tumor is a little bit advanced. Radiotherapy is good in sterilizing the tumor. So it is definitely part of cancer treatment.
Right.
But radiotherapy has a downside. And that is, it makes the skin very tight, pigmented. Sometimes there is shoulder stiffness. There is tightness on the chest. Okay. A whole lot of undesirable side effects of radiotherapy, which will happen in 100% of the patient. The degree and extent may vary. So this is radiation damage. Now, until recently, there was no treatment for radiation damage. The only treatment was you remove the affected skin later on and do a flap from the abdomen so that you bring new non-radiated skin and tissue to reconstruct the breast.
Okay. Is it only about breast or any area?
Any area.
Okay.
Any area that undergoes
Gets damaged.
radiation, there is radiation effect on the skin and all the other elements. You
Right.
see? So basically the principle of radiation is that the cancer cells are more sensitive to radiation than the normal cells.
Right.
It's not that the normal cells will not react. Normal cells are also affected by radiation. The cancer cells get more affected.
More affected.
It's a relative percentage. That's it.
Right.
So what is left behind is radiation damaged tissue in 3-dimensional way. Now comes fat graft. You can fat graft this area and it will gradually reverse the radiation damage. It will make the tissue softer again. The healing power of the skin is restored. For example, in the past, whenever there is a radiation damage and there is a wound there, let's say there was a trauma due to the bra strap, whatever, minor trauma, causes a wound. That wound doesn't heal. For months and months, it doesn't heal because the radiated area has lost the ability to heal. Why? Because the stem cells within that are gone.
Right.
This is realized more recently that the
Wow,
stem
it's a
cells
new
are important
research, huh?
for healing.
Wow.
So when you bring back the stem cells by injecting fat from a non-radiated area, of course, then that local skin and tissues improve. And I have many examples. I've used fat grafting in irradiated women to improve the whole chest area as part of the breast reconstruction.
Wow. Is safe?
It is absolutely safe. Fat grafting is one of the safest techniques. Technically sensitive, technically a little bit demanding, let's say, not very demanding. You just have to follow certain principles.
And not for you, I'm sure.
And
But the precision is which is required, it's
precision
there.
is
Yeah.
required, yeah. And not to push the limits. For example, if a particular area needs more fat but doesn't have the capacity to take that much fat, just do it again after 6 months. Don't try to be, over ambitious and push too much fat because, to convey this concept, I usually tell the patients, okay, I give you a puzzle or a question. Okay, let's say there is a room that is totally sealed and you've put 4 people there or 4 goats there. Let's not put people.
Okay, no,
Let's
let's
put
not
goats.
put people.
Let's put 4 goats.
Yeah.
And 24 hours, there is enough oxygen in that room for 4 goats to survive. Now I put 6 goats. How many will survive? Some of them will say 2 will die. Some of them will say 4 will die. But some people get the idea. They say all 6 will die. Yes?
Yeah, true.
Correct?
Of course.
Because there is only enough oxygen for 4. If you put 6,
They all
none
will
of the 6
yeah,
gets
they all
enough
will
oxygen.
suffer.
They all will suffer. And maybe if it is extreme, they will all will die. So if you put more fat in the belief that, okay, 50% is lost, let me put double the fat. You're asking for trouble because all the fat may die. And you may have nothing left at the end of it. Not just that, the fat that does not survive becomes oil. So you start getting oil cysts. And the
Oil cyst,
oil
collection
cysts,
of
like
oil.
collection of the oil. Because the
Okay.
fat cells will burst and they will release the oil that they contain. And lakes of oil will be there, and that oil is irritant to the body, although it's its own fat. But once it is released out of cells, it's kind of irritant
Right.
and forms lumps and cysts and painful and all these kind of things.
So you have to be very careful in
So
how
you've
much
got
you
to
are.
be, you can repeat fat grafting any number of times as long as you give gap between one episode and the next episode.
And how much is that?
4 to 6 months.
4 to 6
I prefer
months.
6 months. Yeah. So fat grafting, we talked about it a lot.
Yeah, actually.
It's really a wonderful thing, and I'm more and more amazed at the power of fat. And recently in 2020, during the COVID, I published a paper, which is the first in the world, published in a respectable journal, PRS Go,
Wow.
where I have used fat to heal a wound, even with the bone exposed. This is new. Just by injecting fat and just by putting fat on the wound, like butter on toast,
Wow.
the fat cells got converted to tissue.
Please share me the link of that.
I will.
Wow. It's
And
beautiful.
that boy went on to heal. And I've done about like half a dozen cases in this way. And every time this
Bone
technique,
was visible.
even bone was visible.
Wow.
Normally you need a flap.
Yeah,
Normally you
of course.
need a
Yeah,
flap.
right. But just
But-
fat and it was.
And it
Wow.
could vascularize. It got blood supply and covered the bone, and the skin grew over it.
So it can be on any part of the body.
Well, you see, the experience is limited. The number of cases that I have done, every case has been successful. So I am actually interested in doing a wider study. I have a protocol. Maybe soon it will happen. We'll do a wider study in a country where you get more of these leg injuries. Here, to get the enough number of patients is difficult.
Right.
To
So
do
what
such a
part? What
study.
part was that?
That was the leg.
That was
difficult
the
part.
leg.
Difficult part. Front of the leg, the shin bone, which is one of the most difficult areas to heal.
Right. Is any age group can go for the liposuction procedure? Any specific
Well,
age
as long
group
as
is
the
there? Because
person is-
obesity is prevalent at all ages.
Liposuction above 18, so it should be an adult. Normally we don't do it in children, but we may do it in teenage if I need fat grafting or I need that fat for a specific purpose.
Reason. Right.
For healing a wound
Reconstructive.
or for burn scar or something like this. With the parental consent, we can take some fat from an older child. See what happens, children below 10, the usual is that they are very, very deficient in fat. Like they have thin, they are thin. I mean, nowadays, of course, children are overweight
Yeah.
very often.
Sedentary.
Yeah, but in the normal way, children start accumulating, especially girl child starts accumulating fat when puberty hits.
Mm.
So normally in a small child, we may not be able to get much fat. So sometimes we wait and ask the parents to come back. Let's say a burn scar or something. I say come back when she is a little bit plump, then I can get some fat. But other than that, 18 and above, we can do liposuction.
Any age. Any contraindications?
As long as, well, a person who's in poor health, who's on a lot of blood thinners, who's a risk for anesthesia. Of course, we can do it under local anesthesia with sedation, but there are some medical conditions where even that may be risky. So since this is an elective procedure, person has to be healthy enough for at least sedation plus local anesthesia. Then
So,
it
Dr.
can be-
Mohan, you can do procedure of liposuction under local anesthesia.
That's true. It can be done under just local anesthetic if the person is kind of brave enough. I mean, when I say brave enough, not having anxiety.
Yeah,
Let's
not
put
to
it that way.
faint.
No, because really it can be done under local anesthesia.
Wow.
When it is limited area liposuction, we give the local anesthetic. We have to wait enough for the
For
whole-
it to get
whole
effect.
thing.
Right.
So that is called a tumescent anesthesia.
Mm-hmm.
And under tumescent anesthesia, we can do liposuction.
And how long the duration is of liposuction?
Well, once we give the local anesthetic, we wait about 10 minutes for it to take effect, and then we can do the liposuction, which may take 1 to 1.5 hours.
And same day discharge?
Same day discharge.
Wow.
And this tumescent anesthesia effect almost lasts 24 hours. So they don't have pain, say 1 hour after the procedure.
Okay.
No. They may have a little bit soreness the next day.
And that lasts for how long?
The soreness will last about 3 to 5 days
Okay.
in the usual cases.
Right.
Okay. But the vast majority that I do under local anesthesia with sedation. Now, what's the difference? Sedation means there is an anesthesia doctor who's giving sedative medicines, mixture of medicines,
Mm-hmm.
to make the person go to sleep. Like it's a deep sleep.
Right.
It's different from general anesthesia. In general anesthesia, the person is unconscious.
Right.
In sedation, the person is deep asleep.
I'm sorry, can we talk about this
So
again?
let's say every night we go to sleep.
Right.
We are not unconscious.
Right.
We can wake up if the noise is loud, somebody wakes you up, and so on and so forth.
Exactly.
But if I say, okay, lie down now, and I click my fingers and you shall go to sleep. It's
Right.
like hypnotism.
Uh-huh.
So here the anesthetist is giving medicines like propofol and mixture of medicines.
Right.
So the person immediately goes to sleep.
Hmm.
Sleep, deep sleep. Then I'm giving the local anesthetic in the area where I'm going to do the liposuction. Okay.
Hmm.
So when I give the local anesthetic, the person doesn't even register that minor pain.
Right.
So there is no anxiety involved because they're just sleeping.
Right.
Towards, let's say I have to do 360 degree, like back and front. I start with the back. When the back liposuction is almost going to be over, I tell the anesthetist, stop the sedative medication because it's running. It's a fast acting medication.
Right.
It acts fast, it goes away
Goes
fast.
away fast. Right.
So they'll just stop it 10 minutes before that and the person comes to light sleep. Then we wake her up and we say, okay, will you please turn? And she will turn herself. She will not remember this, but she will turn herself. And then we go to the front. And then once again, the anesthetist will give more medicine. And then we continue.
I think this,
this
goes
is a
inhalant
very-
as well, right? The
No. This is
by
only-
inhalation?
No inhalation.
I think in certain
There's only-
deliveries.
yeah, that is very short. That is ultra short.
Hmm.
For delivery pain, they give a mixture of oxygen and nitrous oxide. That's called Entonox.
Okay.
So here we give it intravenously, and if it is of interest to anyone, the anesthetists use a mixture of medicines: propofol, ketamine, Presidex. So we're using multiple medicines so that each one does its contribution, and we can use less of each, and the mixture works very well. Now this kind of anesthesia requires the anesthetist to be good in this form of anesthesia, and for the surgeon to be gentle. For example, this combination of sedation plus local works very well in my cases when I am the surgeon. The same anesthetist will say, doctor, but for some surgeons we cannot use this. It doesn't work. Similarly, when I am doing this, and if a new anesthetist, who may be, with all due respect, very good anesthetist, but has not given this sedation for these kind of cases, the anesthetist will be hesitant. He or she will say, no, 4 hours you're going to work, I cannot do under sedation, I will give general anesthesia.
Right.
Whereas with the anesthetists who are trained in and experienced in sedation, we can go 5 hours, 6 hours if it requires.
Right.
Not that we go that long, but we are able to do many procedures under local anesthesia with sedation. So that is good for the patient's physiology
Right.
because the person is not unconscious. Like when you're not unconscious, the body is able to maintain the temperature. Everything is
Yeah, it's
on
kind of a
body's own.
normal.
It's a normal.
Yeah.
It's like sleeping.
Right,
It's like sleeping.
right.
Yes.
So that's a better option
That's right.
always.
That's
What are the common myths and misconceptions you would like to clear out for patients since you come across this procedure a lot? You would like to clarify for the patients who might think of going for liposuction or tummy tuck procedure.
So the number one misconception is that this will make them lose weight. So we are careful in mentioning to each and every patient that, look, this is not a weight loss procedure. They always ask, how many kilos will I lose? I say, maybe 1 to 2 kilos. That's all, doctor? Yes, because it's not a weight loss procedure.
Right.
Okay.
And fat is lighter, no?
Not just
Is that
that.
the- is that the
not just
concept?
that. Not just that. Let's say we take out 4 liters of fat. Okay, fine. Maybe it weighs 3.5 kilos. Okay, that's just one part of the body. But this doesn't change the overall metabolism, the tendency, the body's homeostasis by which body maintains a certain weight. Have you ever paused and wondered, for example, if your weight is 65, why is it just hovering around 65? Some days I eat, some days I don't eat, some days I exercise, some days I don't.
Right.
Amazing, isn't it?
Right,
Body
right,
holds
right.
on to a certain weight,
Right.
plus minus 2 kilos. So that's the concept is called baryostat. Like you have thermostat. You set the thermostat at 22, it maintains room temperature at 22 or the fridge temperature.
Right.
Without having an anatomical localization, our body seems to have a baryostat. And it defends a certain weight.
Wow.
Amazing, isn't it?
Wow.
So for this reason, if I take out 3.5 kilos of fat, the body will kind of reset its weight to what it was approximately. It's not that fat accumulates there. If the person is not simultaneously doing the right things with respect to diet and exercise and lifestyle, the fat in the other areas which are not liposuctioned can increase in size.
Right,
And the weight can be on account of that.
Right.
But if a person has, see, it's like this. Let's say a person has exercise resistant fat. You would often see there are a lot of, I'm saying
Stubborn areas.
I'm saying women because that's where the problem is commonest. Let's say you will see them exercising, walking around the park regularly. You also go for a walk and you see this girl, last 1 month, she's so sincere, but she's got like that kind of a pear-shaped figure, like her lower part of the body is big. Now you see her face is becoming small, her upper body is becoming small, the lower body is not budging and she is frustrated. She stops doing her exercise. This is because those areas are exercise resistant. Those particular type of patients, they are the best candidates for liposuction. Because we can rebalance the body.
Wonderful. Because even in gym, people give away.
Yes,
they give up
because
that
of
this is a stubborn place. We cannot do anything, and you get adjusted to this body shape of yours.
That's right.
Wow,
It can be
okay.
changed by a targeted
Liposuction.
liposuction. On the other hand, somebody who has got an apple figure, let's say obese in multiple areas of the body, they need to address their obesity, overweight situation in other ways. And liposuction is not a solution for them. But once they lose weight, if they have specific areas, we can target those areas by liposuction.
So that's a common myth that it will
That's right.
not cause weight loss. I mean,
That's
usually
right.
people think it's
That's
weight
right.
loss.
The second thing is people think that, okay, now the skin is going to be loose. The truth is somewhere in between. Now, we would like the skin to tighten up and follow the contours that have been created by liposuction. And we will be very glad, and the patient will be very glad if that happens. And it can happen if the skin quality is good. What do I mean by skin quality is good? There are no stretch marks. This person has not had weight swings. There has been no yo-yo. And when you look at the skin,
What is that yo-yo?
Yo-yo phenomenon.
Up and down.
Up and down, up and down.
Right.
It's
Okay.
like that toy.
Yeah.
Right. So
Those are the good quality skin which will
good
recover
quality
fast.
skin which can shrink. Okay. So people think that after liposuction the skin is going to be loose like that. That's not true. It's going to shrink. But how much it will shrink? Will it go to a very tight skin? That also is a little bit too much to expect. So the truth is somewhere in between. Whether you are closer this side or closer to this side depends on the quality of the skin and of course on the type of liposuction and the nuances of the technical aspects of the liposuction.
Right. Okay.
So here comes the use of energy devices. For example, let's say we do the liposuction. We want the skin to shrink more. So then we can add on energy devices which deliver some form of heating to the fibers under the skin. So to make the skin shrink more. Okay. So the energy can be laser, can be vaser. Vaser is like a vibration, almost like an ultrasonic. It can be radio frequency. So these are the common forms of energy that are used.
Okay. And these are safe?
These are safe. if used correctly, of course. Everything, has
Pros and cons.
its technique and limit, safety parameters and all
Right,
that, power
right,
settings, everything
right.
is
Lot of
important.
factors
Lot
are
of
there.
factors.
Right, right.
So we can use these energy devices in addition to the liposuction
Hmm.
to get the skin to shrink better.
Okay.
Now, if we assess that this skin is not going to shrink satisfactorily, and this usually happens in women in the tummy following pregnancies, let's say, so the skin is too loose or it's hanging, then those people need the skin to be removed, whether it is tummy or whether it is sides or whether it is the buttocks which have fallen down, whether it is loose tissues in the arm. And that brings us to the problem of post weight loss. What happens? People nowadays, they take these injectables like Monjaro and Ozempic, or they undergo gastric sleeve surgeries, or they are determined and then they do their diet and exercise and manage to lose 20, 30, 40. With these surgeries, they lose, even up to 100 kilos.
Yeah.
So what happens? The tissues go loose.
Right.
Those
Sagging.
cases need the skin to be removed. You cannot hope to get liposuction and get the skin to shrink. No.
You have to cut
So
off the
we
skin.
have to remove the skin. So those are resectional surgeries, and that's also increasingly common now, and that forms a significant part of my work as well. Post weight loss, body lifting. So these are very grateful patients because they get rid of all those loose hanging tissues. Their body shape improves.
So this is one day procedure
And,
as well. Same day discharge.
No. These resectional surgeries are big surgeries. So we keep them in hospital 1 or 2 nights.
So that's the second myth. Any other common myth you come across
Well,
or misconceptions? You
well,
said about the
fat goes
the
to
fat.
another place. The fat goes to another place.
Yes.
So patients often say, "But doctor, I have heard that fat goes to another place." So that's
Travels.
again that fat doesn't travel because I've already it's in the bottle. How can it go from the bottle to your other part of the body?
Yeah.
So like I explained before, what happens is if they don't follow proper lifestyle, the fat in the non-operated areas can increase in volume, and therefore it seems that the fat has gone to another place.
But it's not the truth.
It's not the truth.
Perfect. So
I've seen that in some people who somehow then, for whatever reason, they start taking antidepressants, let's say for another indication. Let's say they see a psychiatrist and they prescribe antidepressant. Now with antidepressants, there is weight gain.
antidepressants cause weight gain.
Can cause weight gain.
Oh, okay.
So they come back after 6 months, 1 year, doctor, I don't like the shape of my body and blah, blah, blah.
And they feel stress is the reason. But then, people relate weight gain to stress a lot.
It
And
works
that's
both ways.
that's
It
a
works both
different.
ways. It works. See, antidepressants as a side effect can cause weight gain. Stress can cause weight gain because stress increases cortisol levels. And cortisol tends to favor fat accumulation in certain areas. But the effect of stress on the body is multifactorial. It affects almost every system. Now the importance of stress is more and more realized in traditional medicine and in modern medicine and in popular culture.
Stress is a big topic to be discussed on. Yeah, we will talk about that for sure.
Yes.
So you said that the
So
antidepressants cause increase
I
in
brought
weight.
the example of antidepressants only because I encountered this in a couple of patients when I had given her a very nice shape and I had seen her a few times and everything was good. And I see her again after 2 years and I say, "What happened to you?"
Okay.
So then she said, "Doctor, I took these medicines and this and that." And I said, "Okay, fine. Do you really need these antidepressants? Take another opinion. Maybe you go for therapy rather than drugs." And the same patient came back to me 6 months later with the shape regained after she stopped the antidepressants and went on therapy and sorted out. So what I'm trying to say is whatever reason, if you become sedentary, because she said after the antidepressant, she said, "I feel sleepy all the time. I'm not doing anything. I'm just," maybe she was on an overdose. Maybe she did not require that particular tablet.
Right.
Whatever,
So another important takeaway that instead of antidepressant, you go for a
No,
therapeutic
I am
way
not.
of.
I am not.
No, I'm
I'm
sure.
not a psychiatrist. This is best left to the professionals
And
concerned.
it's
But I just
understand.
quoted it as an example to explain the dynamics of what happens to fatty tissue because it is closely intertwined with your lifestyle, with exercise routine, diet, what you eat, and all that. So in physics you have this law of thermodynamics that energy balance has to be there. You cannot wish energy away. So if there is excess energy in the form of calories consumed, it shall be parked somewhere else as fat. But at the same time, you have some people who eat whatever they want and they stay thin. But if you
I wish.
scientifically
I wish.
analyze them, they probably have a
There are
higher.
some people who get fat with breathing the air as well, and I'm one of those. Oh my goodness.
It has to do with the
Yeah.
basic metabolism and the ability of the efficiency of the body to handle the calories that you're consuming. Yeah, that's a complex topic.
So that was a deep dive into liposuction and tummy tuck. And the most amazing thing is fat grafting. I cannot imagine the ways we can use the fat cells, and stem cells can come out of fat cells as well. That's wondrous. It's beautiful. So thank you very much for the insightful conversation today again, Dr. Mohan, and
Pleasure is mine.
wish to see you again. I'm very
Absolutely,
excited to
absolutely.
explore
There is
more with
so
you.
much to cover. There's so much to cover in the field
Absolutely.
of plastic surgery. We've just scratched the surface.
Yes, we have just scratched the surface, and it gives me that adrenaline rush, that you get into more discussions, more topics, and let people know what
For
it is
example,
all
tummy
about.
tuck itself, there are lots of details
Yeah.
which we can talk about next time.
True.
Different
Absolutely.
techniques about the scar, why the scar has to be long.
Right.
What about the belly button, so on and so forth.
So
a
there's
lot of aspects.
People
Yeah.
perceive that it's only cosmetic. The fat cell thing which you mentioned, it's a gem information.
That's
yeah.
right.
So these are small takeaways for people as well, especially the radiotherapy which we mentioned and we talk about.
Because a lot of people don't know,
They
and
don't know.
suffering.
Awareness.
They're suffering.
Yes,
They're
yes.
suffering with the radiated
Yes.
tissues.
And I hope they get benefited by
Absolutely.
watching our show and having
Absolutely.
insights from
Absolutely.
an
I hope
expert
so.
like you.
I hope
It
so.
was an extreme pleasure to have you today on my show. Thank you so much once
The beauty
again.
of it is fat grafting is so simple, yet it has so much of power.
Absolutely.
That's what is impressive.
Absolutely.
Yes, yes.
Thank you once again. We'll talk more in our next show. Yeah.
Welcome,
Thank you so much,
welcome.
Dr.
Bye-bye.
Mohan. Thank you. Thank you.